Good morning. My name is Jennifer Deasy. This is my video for the Congress of Future Medical Leaders Medical School Scholarship Challenge. My quest is to find a cure for migraines. When I was at the Congress in February, one of the people who inspired me was Dr. Capecchi. His research in genetics, stem cell development, and mammal neural development inspired me to ask questions about neurological issues, like migraines. And I was also inspired by Dr. Bolt's recovery from brain damage and Laura Dominguez-Tower's miraculous recovery from paralysis through stem cell use. And this led me to speculate the potential stem cells may have in healing brain damage associated with migraines. Migraines are a chronic disease that do not have a cure. However, migraines do not receive nearly as much attention or medical research funding as other chronic diseases like Alzheimer's disease or obesity. Chronic diseases receive 75% of the nation's healthcare dollars, but migraines only receive 0.03% of that amount for research. This is equivalent to 42 cents per sufferer per year. This is especially low funding for research, considering 12% of the United States population, 36 million people, suffer from migraines. And this is still 20 million more people than those that suffer from cancer, Parkinson's disease, and Alzheimer's disease combined. Migraines are particularly near and dear to me because I have suffered with migraines since I was 11 years old. First diagnosed with them after experiencing confusion, visual disturbances, and persistent headaches, I felt alone. However, through my research, I realized that millions of others share this disease with me. Migraines may be forgotten about for research grants and aid because they are not deadly. While not fatal, they can greatly affect the quality of life for many sufferers because they can occur at any time without warning. Their symptoms, such as pain, vomiting, and visual disturbances, can be potentially dangerous to the individual too. These patients seek pain relief and preventative treatments on a daily basis, but these medications are well known to be addictive and can carry many adverse side effects, such as weight gain or increased chance for a stroke, which cause their own health problems independent of the migraine itself. Migraine sufferers use an enormous amount of healthcare services for relief and treatment, totaling $50 billion yearly. The economic costs of migraines total around $13 billion in lost revenue for businesses whose employees miss work because of migraines. Clearly, migraines are a very large medical and social problem, and they deserve the research to find better treatments and cures. So I want to go to medical school to research migraines. When I go to medical school, I want to become a neurologist and treat migraines and seizures, which are very similar to migraines in many neurological ways, as my specialties. I plan to carry out this research and to find long-awaited relief for migraine sufferers. After all, who would understand migraine patients and the hardships they face better than a doctor who also suffers migraines herself? Right now, I'm currently engaged in fundraising for the Migraine Research Foundation. For local events, I've created information booths and distributed migraine information, and I'm right now in the process of organizing a bicycle outing, sponsored by local small businesses, with all proceeds donated to the Migraine Research Foundation. My hypothesis is that if the brain lesions that are associated with migraines can be treated with stem cells, then a cure for migraines may be found. My research plan involves lesions in the brain called migraine spots. People that suffer migraines have these lesions in the white matter of their brain. While these lesions are connected to migraines, the connection is unclear, as well as what causes them and what damage they may do. However, migraine spots have been connected to strokes and heart attacks later in life. Here's a picture of what one of these lesions looks like. I plan to research the lesions' connections to migraines to see if treating the lesions may cure migraines. Dr. Capecchi inspired me to recognize the strong genetic component migraines have. Studies link migraines to the X chromosome, which explains why 25% of women suffer migraines while only 9% of men report getting them in comparison. This is because women have 2 copies of the X chromosome, which makes them more vulnerable. This also accounts for the strong chance of inheriting migraines from one or both parents. Those that have migraines have very sensitive neurons, which can account for the severity of physical symptoms associated with migraines, like headache. Researchers have also linked migraines to a variation in chromosome 8, right in a section that helps control the neurotransmitter glutamate. Glutamate is a major excitatory neurotransmitter in the nervous system that's associated with almost all of its operations. Glutamate is necessary for normal brain function. Researchers have also found a connection between migraines and genes controlling the iron levels in the brain. Clearly, there's a lot of different research findings for why migraines may occur in some people and not in others, though none of it has yet to yield an effective treatment or gene therapy targeting its potential causes. 12 sections of the genetic code have been shown to variations among migraine sufferers, with 8 of these regions near genes that control the brain circuitry, and 2 of them near regions that keep brain tissue healthy. It's this damage to brain circuitry and tissue health that I wish to explore with stem cell treatment. It was at this point in my research where I was inspired by Dr. Bolt and Laura Dominguez-Tower's journeys. I pose that recovering stem cells to treat and perhaps heal these lesions in the white matter of the brain can cure migraines. There are many types of stem cells, and based on my research, they could all suffice to heal migraine spots. Embryonic stem cells derive from in vitro fertilizations that are donated for research. They can also be grown in a laboratory through cell cultures. Somatic stem cells are undifferentiated cells that can differentiate into functions for jobs like growth and repair. Induced pluripotent stem cells are differentiated cells genetically reprogrammed to express genes that define the embryonic stem cells. So if stem cells can help regrow neural connections to body parts, maybe they can regrow neural connections in the damaged parts of the brain? By repairing the brain damage associated with the headaches, by replacing the damaged cells via growth variables with stem cells, migraines can be prevented. And this would replace the hypersensitive neurons and hopefully repair any variations or damage to genes and chromosomes that may be causing the migraine. Most importantly, stem cell treatment would heal the lesions in the white matter of the brain that are associated with migraines. Injecting stem cells to repair these lesions would be a much better solution in terms of suffering and economic expenses for migraines instead of a lifetime of highly addictive and expensive pain medications that cause unwanted side effects. The success of this treatment will be determined if patients report a decrease in the migraines they receive or if the symptoms of the migraines they do receive are less severe. I propose to design 2 test groups. One experimental group of migraine sufferers who have migraine lesions and receive stem cell treatment, and another group of migraine sufferers that have lesions but do not receive stem cell treatment. Comparing these 2 will determine if stem cells repair the lesions or if they just go away on their own. Then a general control group of individuals who do not have migraines or migraine lesions should also be designed, with which the patient's progress can be compared. Researchers should check in with all 3 of the groups on a yearly basis for the MRI brain scans to look for lesions, as well as reports from the subjects stating the progress and frequency of migraines. Migraine spots can only be seen through the MRI brain scan. Since migraine spots can be connected to strokes and heart attacks later in life, research into these lesions should be pursued. Migraine spots may also contribute to permanent changes in the structure of the brain. Much more research is necessary to be able to treat migraines more effectively. Because of this, I desire to participate in and would find no greater honor than to be able to assist in migraine research. Migraines have not only affected me, but many family members as well. Because of this, I would love to be able to find more effective treatments and cures for them, not just for myself, but for all migraine sufferers. Research for migraines can help a vast number of people and should be pursued. You may have noticed that my essay contains very few citations and data statistics. And this is because my idea was not based on any pre-existing idea and is not an extension of any existing research. This is my original idea that I devised based on my individual situation and the situations of millions of other Americans. Thank you for listening to my research.